Hello, everyone. We are going live to answer questions that were submitted through the Instagram Q&A box. You are welcome to ask questions here. So let's get started. First question is, would you suggest avoiding pacifiers altogether? And I'm going to pause and move along based on how I have to post my answers. So you have time to respond as well that way. All right, so let's get started. Would you suggest avoiding pacifiers altogether? If you want to take the pacifier away and your baby immediately goes for their thumb or their finger, then I'm not going to recommend to take the pacifier away. Pacifier is easier to transition away from when about age 2 to 2.5 than their finger or their thumb, which can lead to longer use of that habit. So if that happens, then I would keep the pacifier. But we need to be figuring out why they need the pacifier. And sometimes in the depths of the newborn stage, that's hard to figure out. And before you know it, they're 6 months and they have that pacifier or the thumb or finger habit. So, why is the tongue not going up to the palate space and the baby using that skill, developing that skill? Is what the bigger question is. So, no, I don't avoid pacifiers altogether. And there's more. I want to continue on that thought. So, we are going to keep moving on. I'm going to post this. And we're going to go again. So the idea would be to use the pacifier the way it's intended, which is to soothe, right? And so if baby is crying and needs to soothe and needs some support with that, then I would use the pacifier. But I do not recommend keeping the pacifier in the mouth all day long, even all night long. If you can go in and pull it out and train that tongue to sit on that nerve and that palate space, that is how they develop those cues to calm. And so the pacifier can be helpful. Babies need to suck. They use that reflux to calm. But I don't, if baby is calm, why is the pacifier in the mouth? So that is a way to help. One, for you to see too, is there an oral deficit? All right. We're going to move on to the next question. I hope this is helpful for you guys. The idea is that I want to save these um, for people to just listen to, I guess, in their spare time, right? Okay. Next question. Is there a chance baby will have reflux if the first did? She's very nervous. Hello. Okay. So reflux is a symptom of something. So second baby could have reflux if they have the same things going on as the first. So we know that there's some suggestion of tongue tie being having some sort of genetic component, specifically with the mother gene, MTHFR gene mutation. It's a midline. It affects midline. And so that is, there has some correlations with that. So if you have that gene and it's affected the first one, it could affect the second. But now you know what you're looking for, right? Reflux is a symptom, meaning we can find the cause and correct that, and then reflux wouldn't be an issue anymore. The same thing goes for allergies. If you have an allergy component and it runs in the family, then that may be something that carries over. All right. And on YouTube, if you have any questions, feel free to jump in. I'm answering them through Instagram. And the next question, bottle refusal for exclusively breastfed, just plays with the nipple and the tongue. Let's pop a bottle course would help. Okay. Hello. So, bottle refusal for an exclusively breastfed baby, and they just play with the nipple with the tongue. This really depends on how old baby is. Um, Key factors when you have refusal with a breastfeeding baby, you are going to try to feed outside of the feeding window. A lot of times, parents will either try to feed when baby's hungry or after a breastfeeding session as like a top off, like as a supplement. But that won't work if baby is full or baby's mad because they don't know this. They want what they know when they're hungry. So feed outside of the feeding window. Keep consistency with the bottle and the time of day you choose. So the same time of day, same bottle choice, and take the bottle top off and give them that to play with during the day. All right. We will post that. Um, the thing with, exclusively breastfed babies is that, I mean, they're learning a skill. It would be similar to if you were to put a bottle feeding baby on a breast. They would be mad, right? And so that's always something to like take into account. What is their exposure like to what you're giving them? And do they just need more time and support with that? Um, how is finger sucking going? So um my littlest, she is 2.5, and we've been working on finger sucking. I think it is going good. Um, she definitely has some changes to her mouth. Um, it's becoming wider. She's keeping those lips together more often, whereas most of the time she would have that open mouth because the finger was always there. So it's getting better. I still catch her if she's really, really angry, she will go to suck her finger. So we've been working on things to do instead of that. And so that piece still needs some work. But it's going really well. The pacifier was much easier with my boys, um, which kind of goes into the previous answer that I just did. So it's going really well. It's going good. I guess as good as I would have expected it to. So these things take time. I did try to do a elimination, like passive from the finger when she was around 2, and it did not work. It was not good. So, this is going much better. And then to that, I wanted to, um, post something with her mouth so they can see for reference. All right, let's get back in it. Um, all right, next question is, why did you specialize in infant feeding? So I actually started in the geriatric population. I still work with the geriatrics, that population on the side, and I love dysphagia, which is swallowing disorders. That's where I've focused on with them. And when I went into pediatrics, there was nobody talking about pediatric swallowing, and it was so shocking to me. The clinic I had did not treat swallowing. And so me and an OT started a team, and I sort of took that passion and expanded it into the pediatric world. And then I had my own babies, and specifically infant feeding became like what I specialized in, because it blows my mind that the lack of education and support to parents. Um, so we're going to keep moving on. I really like this, that it's going to be saved and people can sort of listen on their own time. Okay. 3-month-old loves mouthing fingers. Is this okay when to start offering oral play toy teethers? All right. So this question sort of sits into the earlier questions as well. We should be moving away from that. But mouthing is different than sucking on a finger. And so mouthing is exploration, and they're trying to learn and map their mouth. You can absolutely start your oral play teethers now. And I will link my Amazon store. There's lots to choose from. The tubes the parents are a little more hesitant about for their littles, they can still use these. And so don't be afraid of them. The more they're used to it and exposed to it, the better they get and the more the tongue moves. But I do have some other options on there and some vibrating ones just to add a different component into that. But now you can start offering now. For anyone else out there, you can offer oral play tools whenever you want. A newborn can accept them. You would be supporting that more. Yeah, so you can get oral play tools. Like you could use an oral play tube. You would just be using it on baby. I guess I will expand on that thought to them as well, because it's just about oral experiences, and there's no any kind of experience is a great one. And so we'll expand on that thought. And so let's expand on that a little bit. Even for a newborn, let's say you're like, she's crazy. You can get a tube or a toy, and you could just start on the lips or right on the front of the gum line. And then as you get more comfortable and baby gets more comfortable, you'll really see how much their mouth will open more. The tongue will move more. Oral play is appropriate from birth. And you can use your finger or you can use a tool, either way, and it's great for them. All right, we're going to move on to the next question. And I'm linking my Amazon store on my Instagram, but you guys have access to it on my homepage as well. So that is available. And we're going to link that. I don't know what happened. All right. 6-month-old is sleeping with the head tilted back sometimes. Any relation to ties or airways? So yes, there is a relation to it, and you do want to get the airway checked, especially 6-month old. If we've been open mouth breathing for that long, what are our tonsils and adenoids doing? But this little movement right here lets me know, are they having reflux events and it's irritating? If anybody's ever had reflux events or heartburn, you know that like your body automatically wants to go out. Or are they trying to open their airway space? It could be both. It could be that they had a reflux event and things are feeling closed in that space, and so they open up, but essentially they're opening up, right? So why um there's no harm in getting an assessment from an ENT to take a look inside. Always go, so your ENT is going to tell you if they see something. They're not really going to do much. Um, where I am, tonsils and adenoids aren't removed until closer to age 2 unless it's like life threatening. Um, I guess I'll share that as well. I always talk more to you guys. Um, okay, let's do, does lip tie always mean a tongue tie? There is a correlation between having a lip tie and a and there being a tongue tie component. Um, there's a high correlation between that. So if a baby, because it's all midline, right? So if a baby has a prominent, significant lip tie, and the release provider's like, oh, there's no tongue tie, I would question whether they looked for a posterior component or if they're just assessing if there's like a clear cut anterior tie. Um, there is it all, is it absolute? No. Nothing is absolute, right? Hello, if you have any questions or some follow-up responses, feel free to ask. But this is on Instagram. I'm answering questions. Next question. When to see an ENT to look at the airways? Baby had releases, a cranial sacral therapy, myo, and chiro for 6 months. So the ENT can look at the airways at any point. Where I am, an ENT won't do anything unless it's detrimental to the baby until closer to age 2. And they don't consider mouth breathing detrimental. And so usually babies are going to have those enlarged tonsils and adenoids until closer to age 2. Uh, I don't know what you're seeing in your baby. So they had their releases, they had cranio, myo, chiro, like what's going on with baby that you're still struggling. And for 6 months, if you don't see change with your providers, and remember, it's not, I don't expect baby to be 100%, but I expect you to see changes. And if you don't see changes, then I always encourage you to seek a different provider. Sometimes different methods work better. And not all therapists are created the same, right? And so it's important to um, recognize that maybe that therapist is just not the therapist that for you in that particular moment. Maybe they got you to a place and now they sort of plateaued. Then we need to be looking at a different provider or a different direction in our plan of care. ENT said lip tie is nothing to worry about because she's gaining weight. Second opinion. I would get a second opinion if you have other concerns. So what was your concern that you went to the ENT to begin with? And then going back to, is there a posterior tie component? If you're having functional deficits, what's going on? Because there's more to this scenario than just gaining weight, right? We never want to just place our what's happening on whether baby's gaining weight or not. That doesn't always um, correlate with the issues that are going on. Um, in fact, a lot of times it doesn't correlate with the issues going on. So, what's happening where you went to the ENT and you're concerned? And if they were the release provider you were going for, I would definitely get a second opinion if you're still struggling with feeding. Um, and I will say, struggling with feeding, but also like get your team. Um, and I think that's really important. So we're going to talk about it. We're going to expand on that thought. And to expand on that, getting a second opinion of try to find someone who works within a team approach. I find that calling an ENT or a dentist or whatever release provider is and saying, do you work within a team, meaning some sort of functional assessor outside of just the release provider, that you tend to find a more comprehensive view of what's going on. So that's a way I tell parents to sort of sift through release providers who works with a team. Um, those those people tend to have a more well-rounded view of what tongue oral restrictions do and are. Um, okay, I'm really liking this. We're going to do 10 more minutes. Um, if you guys don't follow me already, I'm on Instagram at infant.feeding.specialist. And all right, last one. 4 weeks post tongue tie release, reflux got better for a week, but now worse since doing exercise. This is interesting because so a lot of times I hear that they did a release and then the symptoms got better. That's because it's like going in for a massage and the first couple of days are better and then your body goes back to what it knows, right? And that's why pre and post is so important, because if you had pre-work, then you release, then the body is more aware of what other plans and sensations and what it can do, and so that the post is more successful. And so since you're doing exercise, was it because you started doing exercises? And I would question what you're doing, like what pieces you're doing, or was it because the body just went back to what it knew after that first week? So what exercises are you doing and what's happening? Okay, you guys. That was great. I loved that. And now it's saved on here. If that was helpful to you guys in any way, please support my page by going to the link for my PayPal and show your support that way. Give me a follow on Instagram and be sure to ask your questions. Um, and I think I'm going to try to do this more often where I record them so that people have it later. All right, let's keep going. We have a couple more minutes. 2 tongue releases, do oral play with mouth open, but still sleeps with mouth open. Concern. So, sleeping with the mouth open is always a concern. Our mouth should be closed so that we're nasal breathing. So, why are they sleeping with their mouth open? We have to look at what the mouth is doing while they're sleeping. Are they congested? Is their airway space open? And or do they have their mouth open during the day, or is it only when they're sleeping? Um, can we support them with some taping just to get the awareness there more? I would want to see what baby looks like, what their muscles are doing, what happens during the day, and how can we transfer that at night? Sometimes just adding do you do your nasal hygiene routine at night? Because doing that can really clear the space. Using essential oils can really help make sure it stays clear and so that the breathing is possible. Anytime we get congested or stuffy at night, they will automatically go to mouth breathing. Um, So open mouth is, it's always going to be a concern because that's not the way that air should be filtered and breathing. And also, your brain never goes to sleep if your mouth is open. We need our brain to get to, we need our body to be in the parasympathetic nervous system state of being in order for our brain to truly shut down. Um, so we're going to do that. What did I talk about? Oh, yeah. We talked about, and I have a free nasal hygiene protocol. Um, Um, and it is great. So if you're interested, that's linked on my front page as well, inside the app. So we're going to link that here. And we are going to go to the next question. And we are just going to do a not medical advice tag right here because you never know. With people. All right. So, hand finger sucking bad. 4-month-old seems to play with when happy. Prevent. So, playing with hands and fingers is different than sucking on it. So, are they sucking like, or here? And they're just playing and happy and they're talking to you and they're anchoring their mouth down and they're just sucking away, or a finger up here and it's just sitting there creating that big high palate, then yes, we want to prevent that. So get something in their hands, add a teeter that has some input. If they're seeking some of that input, start looking in their face and doing clicking. But if they're just playing, like if they just have their finger in there and they're moving it around and playing and munching and exploring, that is different. But if they're anchored down either way with one or two fingers or their thumb and they're sucking, or it's just hanging out in one spot, then yes, we want to prevent that. Because that is the difference between oral exploration and a sucking behavior, using it as a sort of habit. Okay. All right. And I think that is it. That was awesome. So I'm so excited for that. And oh, wait, one just came in. 7-month-old with thumb sucking habit when sleepy started the oral guide too. Um, okay. We'll say that for the next set. All right, you guys. Thank you for joining me. All of my links are on my homepage. Let me know your thoughts. If you have any questions, feel free to submit them. And I will talk to you guys later. Bye.